Welcome to our presentation on ultrasonography of the adrenal glands. With the question in mind, are you listening to what your sound is telling you? So the whole point of this presentation is to take a new way of interpreting ultrasound imaging of the adrenal glands, and I think you'll find it interesting, although a bit controversial. When it comes to how we've looked at things in the past, the tradition has been to measure the caudal pole of the adrenal gland and with it make an assumption whether the animal is cushingoid or not. Many of the observations that we've made on adrenal glands is they are plump or anechoic, and in my personal opinion, I really wonder if they add anything to our diagnosis. I mean, the truth being said, what does it really mean? So conventionally, or by tradition, we've, as I've said, measured the caudal pole of the adrenal gland, and we've compared that to measurements that have been published in the literature. The things to take into mind is, do we really want to make a diagnosis with a ruler? Although it's been a tradition to do so, or by convention, do we really make a diagnosis with a ruler? So when in the past we've measured the caudal pole, the question begs to be asked, does it really mean anything? And what on earth do the values give us? How does it move us ahead with our diagnosis? And is there some confidence with the measurements that we're taking? Typical veterinary publication, we come in with that range over and over again, whether it's 0.7 or 0.8 or 0.65 millimeters. If you've got a dog who's 0.75, is he really cushingoid? So the limitations of measurements, there's no real true reference that I would hang my hat on and be totally confident with the diagnosis of Cushing's disease. Secondly, the glands appear to be sonolucent due to limitations of older technology. If you look at the images that we posted there, the adrenal glands are uniformly hypoechoic or sonolucent. The common belief is that Cushing's disease cannot be diagnosed by ultrasound imaging, but serum testing alone or biochemistry. I'm going to challenge that today. The sensitivity and specificity of the measurements is not really stellar, as you look at there's the arguments in the published literature. So to me, there's got to be a way of looking at the adrenal glands and looking at their activity. In other words, what are the glands doing? So the question that begs to be posed is, what if? What if we changed our way of looking at the adrenal gland and the information that your ultrasound imaging is providing you? What if we changed our way of interpreting results? What if we start to look at or hear what the probes are telling us of the activity of the adrenal gland? And this is a whole new way of looking at things. Take into account when the Hubble spacecraft went into orbit and how much more information that we acquired about our universe just with the clarity of the images that it was able to produce for us. Just the fact of having higher resolution images, such as the following, shows all of a sudden a whole new light on what really is going on in the universe. Well, technology has changed for veterinarians as well, and we do have access to higher resolution imaging of the adrenal glands. And I think it's time to take it up one notch and face the challenge here. So just as we look at these images here, we can see that all of a sudden we get a lot more information about the adrenal gland itself. The image on top is older technology, commonplace out in veterinary clinics, and the image below is what you could expect with some of the newer technologies. So, what if? The keywords, what if? What if we drop the ruler for now? That we didn't focus so much on just how many millimeters, and we looked at the gland and we looked at its functionality. In other words, what is the gland up to? What area seems to be more active than not? So let's go back to some old images here. here, not a lot of information, although if you strain yourself, you can see some evidence of layering in these adrenal glands. Well, let's look at it now with a higher resolution linear probe. And all of a sudden, you're going to start to see some really interesting detail in the glands. Notice the layering, very much like what you would see in intestinal layering on a section of jejunum, for example. All of a sudden, you are seeing distinct layers, anatomical layers of the adrenal gland and its vascular supply. How do you get these images? Well, one of the things that you use is a high-end ultrasound machine. You use high-frequency linear probes. You image everything in the near field of the patient. Sedation is almost essential. And then once you have the image, zoom into it or zoom into the point of interest. So let's start thinking of anatomy and functionality of an organ or a gland. So let's start looking at the adrenal gland. We'll look at a histological section first. The first layer that we see that is rather almost anechoic is called the zona glomerulosus, and that layer produces aldosterone. The next layer that we see is more hyperechoic, and it's actually separated to two different layers of cells on histology. But maybe we can see them or show evidence of them on ultrasound. So this layer is called the zona fasciculata. And the zona fasciculata, again, is very, very important. Is divided into the zona reticulosus, and that layer produces sex hormones. The zona fasciculata produces glucocorticoids. And then the very last layer in the center, that's imaged here in red, is the adrenal medulla. And that's where things like norepinephrine and epinephrine are produced. So if we look at our typical schematic display of the adrenal gland, we get some kind of a feeling of the different histological layers, and oddly enough, they coincide pretty nicely with what we see on ultrasound. Here you can see the cortex, the next layer separated into the fasciculatus layer and the reticulosus layer. Again, if we read, we can see that each layer has very specific functionality in the sense that what chemicals or hormones it produces, and they are very, very specific. So depending on the activity of this is for the adrenal medulla right now, but depending on the activity of the adrenal gland, which layer is hyperactive, you might want to consider that maybe we might see on ultrasound some changes in that layer that we would see on, let's say, abdominal ultrasound of the muscularis layer of the intestines, for a second, has an example of hyperplasia. So histologically, hyperplasia of the zona fasciculata layering is possibly limited to the compact cell layer. On ultrasound, what we see is when that becomes hyperactive, they'll produce more uniform and anechoic layer that represents heavy production of cortisol. Let's take a look at that. So here we can see very nicely the layering on the adrenal glands, and we can see actually increased vascularity on the image to the left of the cortical layers with blood supply. Now, a normal cortex probably, if we look at the hypoechoic zone within the cortex, it should be a 1 to 2 to 3 thickness ratio when compared to the hyperechoic layering. In Cushing's disease, that reverses itself and it becomes a 1 to 1 or a 3 to 1 ratio. So let's look at this again. Cortical layering ratios. Glomerulosus layer compared to the hyperechoic fascicularis and reticulosus layer. Normal would be 1 to 1 or 1 to 3. Now let's just highlight these layers here. So the glomerulosus here is appearing as a darker blue, and a lighter blue would be the fascicularis and reticulosus layering. So when we're measuring this, or if we look at this a little bit closer, we'll come back to the same image here. We have to look at where we want to evaluate the layering. and what areas should you be measuring in your office or your veterinary clinic. So once you've got this image, and it is possible to get consistently, we're going to measure the hypoechoic layer, which is the glomerulosus layer, and then we're going to do the hyperechoic layer, which is the fasciculatus and the reticulosus layer. Now, yes, here you would be using a ruler to make comparisons, but you can almost do it visually with your eye at the same time. So the same thing at the other pole of the adrenal gland in this case. And I think it's important that you do it in a few places in order to acquire, a pretty representative measurement. So taking that into account, we've got these measurements. We're going to look at normal, a 1 to 1 to 3 ratio. In other words, the hypoechoic to the hyperechoic area of the cortex. And an abnormal is a 2 to 3 to 1, or a complete loss of layering that you would see with neoplasia or an adrenal gland tumor. So normal, abnormal. Can we see the difference there? Hopefully you can appreciate that the hypoechoic image on the abnormal side is much thicker. So again, let's look at some histological images, keeping in mind what we would expect to see with a Cushingite dog. And so when we look at this image here, the box that's just appeared represents the whole cortical layer in the pet. And you can almost pick up that there's 3 distinctive layers that are showing up with this stain. Looking at the first layer one more time, the zona glomerulosa. Here's where aldosterone is produced in the pet, or in a human gland, or any adrenal gland of any animal, if we look at that. The next layer that we're going to look at is going to be the reticulosus. And this is where your sex hormones are produced mainly, so your cholesterol from your blood is converted into them, and would be the source of that kind of a tumor. The middle layer is the zona fasciculatus, and interestingly enough, this is where all the glucocorticoids are produced. Let's keep that one in mind. If we've got a Cushingite animal, this is the layer that we're going to expect is going to be behaving abnormally. When we start looking at an animal who's becoming Cushingite, that layer is gradually going to change as the production of cortisol increases and increases over time. So sometimes you can't see the change right away depending on the sensitivity of your machine, but eventually that whole layer, the fasciculata, is going to become anechoic as it becomes more and more uniform, as the production of the cortisol becomes, its main priority. So if we look at the image that's on the top left of this screen, notice how the similarity, how thin the zona reticulosus, the zona reticulosus is compared to the hypoechoic area that is now the combined glomerulosus and fasciculatus. You could ask your question, is it, the change is significant alone? You're probably going to say probably not, but I'm going to be very suspicious. So the other thing I like to look at is the liver, the gallbladder, the pancreas, and the kidneys, and you should see some changes in some of these organs that should go hand in hand with the diagnosis of Cushing's disease. So if we look at the liver, the first thing that we're going to expect is to see nodular hyperplasia. And nodular hyperplasia is not an abnormal thing in dogs. It's a common finding in older dogs. What's abnormal is to be able to see them well. So I've altered the image on the right to make it look like there's no nodular hyperplasia, but as the liver becomes more and more hyperechoic with Cushing's disease, it creates contrast to allow you to see the nodules. So you should see, if we look at these images here, we can see a liver that's riddled with nodules. But once again, you only see them because Cushing's disease has created a hyperechoic state to the liver. The other thing that you're going to see is some biliary sludge in all of these pets. And in many cases, you're going to see the beginning of a mucocele, or the progression or the early stages of one. The videos here are representations of what you might see in a Cushing patient. So hyperechoic liver, nodular hyperplasia in the liver, biliary sludge, up to the formation of a mucocele. The other oddity that we see with a lot of these patients is that for some reason that I can't explain as of yet, the pancreas becomes very prominent on ultrasound and very, very easy to find. Actually, some of your best images will be of the pancreas of a Cushing pet. The other thing we see are focal areas, not in every pet, but in many pets you see focal nodules that are hyperechoic that are present in the renal cortex of the kidneys. Significance of which I'm really not sure of at this point, but it's an observation worth thinking about and keeping an eye on. So if we're thinking in a new way, let's put down a ruler and take the ultrasound to a new level. Let's learn to listen to what the transducer is telling us about the status of the tissue, and ask yourself the question, what should the tissues be doing under certain circumstances, and what would that look like on ultrasonography? In conclusion, ultrasound can demonstrate changes in cellular activity of readily identifiable cellular layers. It's an interesting way of looking at things. An ultrasound diagnosis of certain diseases can have a higher probability of being accurate when it is associated with multiple current findings as opposed to just one discovery. I hope that this presentation changes a little bit how you may look at organs. Although being controversial, I hope that it's open to questioning and verification if in fact this interpretation of a reading of an adrenal gland is in fact correct. So the idea of the presentation is to create a new way of thinking and looking at adrenal glands and bring ultrasonography to a new level of confidence in your ability to interpret what is actually going on with the pet. So keep an open mind, think out loud, expand your horizons, and let's go seek the truth. Take care, and thank you for taking the time to listen to this video. Thank you.